My friends, I stand before you today as a proud American, as a Hoosier, as a father, as a patient, and as a physician that has dedicated 25 years of my life to the practice of medicine. We are here today because we have a grave concern as to the direction healthcare reform is taking in Washington, D.C. Out of the House of Representatives, we've witnessed one of the worst and hardest to understand pieces of proposed legislation in our lifetimes. In the Senate, it appears if things aren't much better. This type of legislation must stop, it has to stop, and we can wait no longer to put our elected representatives back on the right track. What we do know is that in America we have Americans without health insurance, and the cost of providing that health insurance is spiraling out of control. We know that despite the attempts of many to demean our current delivery system, that our current system breeds innovation, it breeds development for the rest of the world. It produces the finest doctors and provides the finest health care by any definition. We know that when it comes to cancer survival, the most important determinants of cancer survival are early diagnosis, early treatment, and access to the best drugs. There is no better than the United States of America. When you factor in the poor lifestyle choices of Americans that lead the world in obesity, and we adjust for violent deaths, such as motor vehicle accidents, Americans have the longest life expectancy in the world. When I can go to my doctor tomorrow and get my cataract fixed, have my knee scoped next week, have my hip replaced, this is the ultimate in accessibility, and this is what Americans expect. These are the facts, and I am talking about a system that needs to be refined rather than completely torn apart. As a physician, I firmly believe in universal health coverage, but politicians would lead you to believe that the public option and universal health care are synonymous, and/or that one cannot exist without the other. This is not true. Some politicians would say that the public option will introduce competition into the marketplace and that it will drive down costs. Let me be crystal clear. Both of these claims couldn't be farther from the truth. We do not need a public option to be able to achieve the coverage of underinsured Americans. In fact, we firmly believe, as does Senator Lieberman, that the public option is a huge and costly entitlement program. We believe the debt can break America and send us into a recession that is worse than the one we're fighting out of today. While there may be assurances that the new national health plan would operate on a level playing field as negotiated rates, quote unquote, the government will use its regulatory, pricing, and taxing authority to favor its government plan, eventually driving the private insurance industry out of business. This is plain and simple economics. As a new public option is able to pay rates below competitors, their products, so to speak, will price the private insurers out of business. My friends, this is the same insurance that 80% of you say that you like. Gone. Research by the nonpartisan Loon Group shows that as many as 118 million Americans could lose or be switched out of their private insurance. As the private insurers disappear, the public option becomes the only option on the slippery slope to a single payer and socialized medicine. Once these private plans have been driven out of the marketplace, people will realize that the government plan will not be able to sustain the quality and the quantity of benefits promised. Government instead will begin to ration care and services, drive out innovation, drive out competition, and drive out patient-centered quality. I can guarantee you that as a physician, the care that I will be able to provide to you under these circumstances will not be able to compare to the care that I give today. As you may have heard, the Senate version of the public option currently has an irrelevant state opt-out provision. You know, this is like telling my son that he needs to cut the grass, but he can opt out of his allowance. Few, if any, states are going to opt out. Indeed, 41 of our states have a Democrat governor or legislature, and it actually takes legislative action to opt out. The state opt-out provision is an insulting concession and represents what, again, is an empty offer. The public option does nothing for lawsuit reform. It does nothing to reduce the administrative costs of health care. It will actually make them worse. It will eventually make private insurance industry extinct, and it won't provide the kind of promised competition in the private insurance market we need to really lower costs and offer the people plans they actually like. What we're talking about here is the government's eventual seizure of 1/6 of this nation's economy. We must say no. We must stop it now in any form and any contingency. For years, politicians have discussed lawsuit reform, but have really failed to enact any meaningful legislation at a federal level. Nationally, doctors spend $400 billion a year in medical malpractice insurance coverage to ensure that we're not wiped out by a junk or frivolous lawsuit. We spend an additional $100 billion a year on defensive medicine. Wouldn't it be nice to pass this savings on to patients or people that are unable to afford insurance? Unfortunately, the recently passed House bill has provision that actually punishes states like Indiana that enact and have effective lawsuit reform. I quote, "A state is not eligible for incentive payments if that state puts a law on the books that limits attorneys' fees or imposes caps on damages." This is absolutely ridiculous. So let's talk about some meaningful, constructive, common sense health reform that will go a long way in reforming our nation's health care. First and foremost, we need individual accountability. People, we have a crisis of human behavior. Consider that it's estimated that obesity accounts for 21% of our healthcare spending. Obesity is related to hypertension, it's related to diabetes, it's related to breast cancer, colon cancer. USA, our country, is the most obese nation on this planet. Tobacco abuse is linked to heart disease, stroke, lung cancer. Lung cancer is the #1 cause of cancer in men in the USA. 89% of lung cancer is related to tobacco abuse. We need healthier lifestyles. We could also lower the cost of health care for patients by eliminating unnecessary paperwork and bureaucratic red tape. About 35 cents of each healthcare dollar is spent on administration and not on actual treatment. We need a better, less complex reimbursement system that cuts down on administrative costs so that we can pass the savings on to the patient. We need to eliminate state insurance monopolies, which would allow more private market competition. We need to allow insurance companies to sell policies across straight lines. This would give people more choices with better prices. Hoosiers who live in a bordering state aren't prohibited from buying their groceries across the state line if they find a better price. Why shouldn't the same principle apply to health insurance? We need to encourage the expansion and the use of health savings accounts, which puts the healthcare dollar back into the hands of the consumer. And this would also promote transparency among providers that would also help bring down prices. In my family, we have an HSA, and I can tell you when my wife needs her mammogram that she's shopping it around. And by the way, she's going to get a mammogram every year. Shopping it around is how the free market controls prices. And let's take the dollars saved by effective tort reform, lawsuit reform, medical malpractice reform, and put it back into the pocketbooks of the consumers. $500 billion. The question that we must ask today is who benefits from the House or proposed Senate bill? Indiana patients with existing coverage could lose that coverage and be forced into a government-run healthcare. Indiana Medicaid will be expanded to 150%, potentially 150% of the poverty level, adding additional stress to our already stressed and grossly underfunded Medicaid programs. You'll be paying for that. This has been referred to as the mother of all unfunded mandates. Indiana, who leads the nation in tort reform, will actually be punished for capping attorneys' fees. Indiana workers could lose their jobs due to expensive new mandates and penalties on employers. Many Hoosiers with private health care will be paying more as the huge government-run plan inevitably shifts costs onto the private sector. And lastly, our Indiana seniors will have fewer options and see the Medicare budget slashed by hundreds of billions of dollars to help pay for this House bill. This is a travesty. We need to commit every resource we have for our seniors. If this is what you want, I say do nothing today. If you oppose the public option, if you oppose government-run health care and the lack of substantive tort reform, then act today, sign our petition, and call Senator Bayh. Thank you and God bless.